Welcome to the SBIRT training for nurse practitioners across the lifespan case scenario series. This project was supported in part by funds from the Center for Substance Abuse Treatment, Substance Abuse and Mental Health Services Administration, the Department of Health and Human Services, under the grant SBIRT Training for Nurse Practitioners Across the Lifespan. The information or content and conclusions are those of the authors and should not be construed as the official position or policy of, nor should any endorsements be inferred by the Center for Substance Abuse Treatment, SAMHSA, the DHHS, or the U.S. government. The authors have no conflicts of interest, and we hope you find this series of case scenarios educational and useful in your practice. Isabella Rodriguez is a 33-year-old Latina single mother. She has come to the clinic for birth control and reports that she often gets anxious when trying to keep a balance between school, her job, and caring for her 2-year-old daughter. In order to unwind and manage stress, she smokes marijuana. Isabella was given the drug abuse screening test, otherwise known as the DAST. The objective of this case vignette is to compare and contrast two approaches to screening and intervening with a patient who is using marijuana. While watching this scene, please note areas for improvement.
Hi, Ms. Rodriguez. How are you doing today?
I'm all right.
I'm Josh. I'm going to be the nurse practitioner meeting with you today. It says here that you're here interested in some birth control.
Yes.
Oh, okay. Excellent. But before we begin with birth control, it also says that you had some marijuana and some alcohol use on a form that you filled out in our lobby. Is that true?
Yes.
Okay. Has anyone ever talked to you about your marijuana use or even your alcohol use?
No, I mean, I just do it to relax.
Yeah, and I understand that, but the issue is that a lot of the use can really affect your family or even affect your reproductive health. Like the marijuana use can affect your teeth, but it can really slow down the development of your child. Or if you're drinking alcohol and having unprotected sex, it's not good for a growing fetus, and you can have a lot of abnormalities. No one's ever spoke to you about that?
But I'm not pregnant, and I came here for birth control.
Sure, and we're going to provide you with that care, but we also want to talk to you today about, stopping the use so that you can be more healthy, because, our goal is that you're healthy and that we help you with that. So I'd like to talk to you, as well as with your birth control about maybe stopping your use and making a plan. Have you thought about quitting?
I quit when I was pregnant with Sophia, but after I resumed.
Okay. Well, today we're going to make a plan with you to stop use and make you healthier, okay? And we're going to provide you with the birth control you need, and we're going to try to work with you on a plan to make you healthy as a whole. So if you'd be willing, I'd like to discuss and, actually make a goal, maybe stopping your alcohol and your marijuana use at least, today or tomorrow, and then we meet in 3 weeks and discuss how that went. And we'll also give you birth control as well on your way out.
Oh, so I get the birth control today?
Sure. That's something we're going to give you, and we want you to agree to not use anymore as well.
Sure.
Okay, excellent. So right now we're going to give you the birth control. You can get that on your way out, and I'll put that in the computer for you. And then in 3 weeks we can come back in and you can tell me how not using went.
Sure.
Excellent. Okay, well, thank you for meeting with me today, and I hope it works out.
Hi, Ms. Rodriguez. I'm one of the faculty here at the School of Nursing. Thank you so much for allowing one of our student nurses to do your examination today. Would you mind giving us a little feedback about how the patient visit went?
He introduced himself really well, and he pointed out that I wanted to be here for birth control, and that was welcoming. But I have to say that I felt a little bit judged when he was asking me questions about, have you thought about this or that? Does anybody have spoken to you of the bad effects of pot or And I felt uncomfortable at points. And I have to confess that I only agreed to the plan because it seems that that was the only way that I could get out of here with my birth control. But it didn't feel like a collaborative effort. It felt more like him pushing me to agree to something.
Okay, thank you. Thank you for that honest feedback. Josh, so you did a great job emphasizing the risks, and also you focused on her presenting issue, which is she wanted birth control. In the future, we use a strategy called pros and cons, and so we try to emphasize and ask the patient what are some of the good things that she experiences from using alcohol or marijuana, so that she can tell you the benefits that she's experiencing from that. And then you guys can collaborate on a plan. And then identifying some of the cons, she can identify some of her own limitations that she feels she's experiencing around her use. And again, the plan is more focused on what she wants and what would work for her. So I think you did a great job emphasizing the risks, and you definitely ended the session with giving her what she wanted, which brought her into the appointment today, which is birth control. But we want to emphasize more the patient directing the conversation. All right. Well, thank you for your time.
Thank you.
In this first example, you may have picked up that the student was being judgmental, confrontational, and not very supportive. The student interrupted the patient and suggested strategies without gathering feedback. Isabella stated that she felt judged and uncomfortable. She noted that she only agreed to the plan because she thought it was the only way to get out of the office with her birth control. Isabella felt like she was being pushed by a non-collaborative effort on the part of the student.
Hi, Ms. Rodriguez. I'm Josh. I'll be the nurse practitioner working with you today. How are you doing?
Fine, you can call me Isabella.
Isabella, excellent. Okay, so I'm seeing here that you are here for a physical and some birth control.
Yes.
Excellent, excellent. Okay, we're gonna definitely get that done. And I also see that you completed our DAS. Thank you for completing that. That's something that we use with everyone to, kind of see how everyone is doing with any substance use and catch any issues with that. If you wouldn't mind, can I speak to you about your results today?
Sure.
Excellent. Okay, so with your score, it came out as a 5, which shows a moderate risk of use.
Okay.
What substance are you using?
Pot.
Pot? Mm-hmm. Okay. So it looks at 5, so you have a moderate risk of use, which there are some things that you should consider. What about the pot that you like about using?
I mean, it helps me relax. My life can be really stressful. Like, I have a 2-year-old and I'm a single parent, and I work and I'm on grad school and everything at the time, like an ear infection night, and then having to go to work the next day and still finish that project for grad school. It's a lot, to take in. Yeah. So it helps me relax.
Sounds like you're having a lot of anxieties. You're saying that you're using that to help with that?
Yeah.
Okay. What would you say is a con of your use? What about your use that you don't like?
I mean, I wish I could just relax on my own, Sure. And I'm always afraid of somebody, especially at my daughter's school, finding out. Even though at some places, states here, it's legal and it's not a big deal, I know here it's still a big deal. So I don't want anybody at my daughter's school, for instance, to find out, and that would get me in trouble. And God forbid, I don't want to lose my daughter.
Sure. Sounds like you're worried about the risk of using it socially and getting caught.
Yeah.
On a scale of 1 to 10, 1 being that you're not ready to quit, and 10 being you're ready to quit today, how would you rate your readiness to stop using substance?
I'm not sure, but I would guess maybe a 6.
6? Okay. Why not a 5? Why would you choose 6 but not 5?
I mean, if I think about Sophia, my daughter, I think I can go one step further.
So it sounds like, your daughter would be a good protective factor for stopping use. Excellent. So I would like to discuss maybe how willing you are maybe to reduce your use a little bit, like maybe next week. How comfortable would you feel on reducing your use, and how do you feel you could?
I mean, I would never do it like cold turkey,
Sure.
but just like reducing it.
Yeah,
like,
just reducing it. I'm not asking that you stop immediately, but to
Like
reduce
cutting
the
back?
risk. To reduce the risk of any substance use.
I mean, I don't know, maybe I can try to, some days that I have help with Sophia and I'm not feeling as stressed, I could try not having
Okay.
to smoke that day.
Sure. That's a good goal.
But I can't promise, but
Okay.
I'll try.
But that could be a goal, and there's no shame if you don't meet that goal. It's more about doing your best to reduce the risks of your use. So you identified that anxiety and stress is the real promoter of when you use marijuana. Do you have any alternatives you could rely on to reduce your stress? Things you could do outside of using, like exercise or...
It's been a long time. I used to swim.
So you like swimming?
Yeah, I
Could you
love
fit swimming into your week or every other week to try to find outlets for your stress?
I mean, at my school, I go to grad school, they have a pool. I could try. It's
Sure.
just, it's been a long time, but
Maybe as we talk, we can continue maybe to build a database of things we can do to reduce stress.
yeah, that sounds like a good plan.
Okay, well, I'm glad you talked to me today. Thank you.
Thank
I'm
you.
going to get you ready with your birth control.
Okay.
And then we will speak soon. How was 3 weeks?
Sounds perfect.
Excellent. Well, thanks for coming in today.
Okay. Thank you so much.
Thank you.
Hi, Ms. Rodriguez. I'm Holly. I'm one of the faculty here at the School of Nursing.
Hi.
Thank you for having one of our student nurse practitioners work with you today on your appointment. Would you mind giving us some feedback about how the appointment went for you?
It was better than I expected. I felt respected, especially because when he mentioned like a form that I had to fill earlier, and he mentioned like substance use and pot, I was like getting a little bit anxious about it, but he mentioned in such a way that I didn't feel singled out.
Okay.
Everybody has to fill those forms, and he asked me questions that made me think about my use and strategies. So I really felt respected, and most of all, I didn't feel judged at all. And I have to confess, I felt a little hopeful that one of our plans, that he's coming up with a database of ideas for me to cope with stress some other ways that might work.
Wonderful. Well, thank you for your feedback.
As you can see, this second example, where the student took the time to build rapport, elicit feedback, and discuss options with the patient, yielded a better outcome. One of the key points of SBIRT is using a validated screening tool. Isabella completed the Drug Abuse Screening Test, or DAST, which opened the door for conversation about her marijuana use. The steps to any screening process are to use a validated screen, introduce the subject, discuss the patient's score, and provide feedback. Isabella scored a 5 on the DAST, which indicates a moderate level of concern about her drug use. Using this information in the second example, the student was able to connect with the patient, learn that she uses marijuana to relax, and then explored other potential methods of relaxation with the patient. With regard to the brief intervention, it is important that the patient does not feel that he or she is being judged for using alcohol or drugs. In the second example, by using a motivational interviewing approach, the student was able to help the patient think of ways in which she could relax without the use of substances. The brief intervention includes summarizing pros and cons, building rapport, and planning next steps together. While this patient might not be ready to stop using substances altogether, there are a number of things she can do to reduce harm associated with her use. Refraining from driving while using alcohol or other substances is a simple example of a harm reduction technique. Many patients we encounter are using more than one substance. For example, Isabella primarily discussed her marijuana use, but also reported using alcohol. It is important to gather as much information as possible, including administering multiple screens if necessary. Finally, it would be a good idea to reinforce the patient's decision to initiate birth control, and also to remind her that many types of birth control do not protect against sexually transmitted diseases, such as HIV and hepatitis C. Principles of harm reduction can be found at harmreduction.org.